According to Birmingham, Alabama television station ABC 3340, on June 10th, 20 Alabama hospitals received federal warnings over price transparency requirements. And it mentions the practices have received federal enforcement letters over alleged failures to comply with hospital price transparency requirements. And this is part of a nationwide enforcement effort targeting 519 hospitals that officials say are not providing the public with required pricing information for medical services. The Centers for Medicare and Medicaid here has issued two types of enforcement actions: warning notices and more serious corrective action plan requests known as CAP. Hospitals that fail to address deficiencies can face penalties of up to $2 million annually. Grandview Medical Center, located off Highway 280 in Birmingham, made this list. They received a warning notice. I'll play my 2023 phone call outlining my issues as a patient customer of Grandview in a 2019 visit with their neurology specialist, Dr. Kyle Hudgens, MD. Grandview has a track record of withholding and denying access to records. 2025 AL.com article mentioned they did this in the civil court case involving alleged sexual assaults that were committed on the Grandview grounds. The lawyers for one woman argued that the hospital was preventing them from obtaining even the most basic information in documents to which they were legally entitled.
Grandview operator, may I help you?
Yes, ma'am. I'm trying to reach the office of CEO Daniel McKinney.
One moment. Thank you for calling Grandview Administration.
I was a patient for Grandview Neurology, Dr. Kyle Hudgens, MD. I called their office yesterday, September 26, 2023, to discuss billing and service issues that arose during my visit. I had a broken skull injury I was dying from. I showed the doctor, printed out X-ray, CT, MRI showing the injury clearly. Dr. Hudgens, looking at the same images, told me no injury appeared there. He provided no useful service in my visit, $265 cash. I would like to inform the CEO that Grandview Neurology staff now use pseudonyms, nicknames, and false names when dealing with the public. I was hung up on when requesting a first and last name from the staff I talked to. She identified herself as Ronnie. At the same time, the representative for the MD make $140 an hour after going to school for 10 years. They request access to patients' PHI personal health data. They seek to remain anonymous. In my case, this practice is now being abused because it's being used to conceal negligence and liability. Also, a HIPAA issue is involved, withholding medical records. When I talk to someone about $1 million health issue, I'm going to have a first and last name for my records keeping before I talk to that person. That's professional. Your customers and patients who pay you money will not accept this corrupt practice, and it will one day soon be done away with, mandated by law. So you heard it here first. Still trying to talk to someone at Grandview about my bill, and you can reach me at that phone number. Look forward to talking to you, sir.
Thank you for calling Grandview Medical Group Neurology. The office of Drs. Kyle Hudgens, Rodney Swilly, James Strong, Drew Urich, Stephen Suggs, and Natalia B.
Hello, I'm trying to reach Ronnie.
This is her.
Yes, ma'am. I called yesterday regarding my bill and a visit with Kyle Hudgens.
One second, what's your date of birth?
Okay, do you have a last name?
I'm not giving you my last name, sir.
Okay, so
I'll give you my initial.
Okay, Grandview doesn't give the first and last names of people that deal with the public?
I can give you my first name and my last initial, sir, but I do not give out my last name.
No, ma'am, you'll give me your first and last name, or I can't talk to you.
Okay, well, unfortunately, I will not be able to talk to you then. Thank you, and you have a good day.